Welcome to the Vanderbilt Online Guide for Children's Health. The following podcast is an interview with Nicole Proffitt and John Z. Holt from Metro Nashville Public Schools Office of Coordinated School Health. Nicole is the Coordinated School Health Specialist for MNPS and has taught lifetime wellness and physical education for 9 years before moving to the Office of Coordinated School Health. John Z. is the Assistant Coordinated School Health Specialist for MNPS. They will provide insight into how the Coordinated School Health program is run in Metro Nashville Public Schools as well as across the state. Conducting the interview is Carlin Rosenblum, Healthy Children's Program Intern for the Vanderbilt Children's Health Improvement and Prevention Department of the Monroe Carroll Jr. Children's Hospital at Vanderbilt.
So, why is coordinated school health a mandate in Tennessee?
I think a lot of it's because of the obesity rate in Tennessee has become so high, and I think we're ranked third or fourth. I know, what was it last year, third in the country for obesity rates with our youth and stuff. So I think that's it helps with screenings, vision, hearing, but it also helps with the students in the smaller rural counties who don't have access to health care. Coordinated school health kind of gets that message out there and gives them access to health care that they wouldn't otherwise have.
It started out in East Tennessee too, where, like she said, is mostly rural counties. So they piloted it in East Tennessee, and it went so well that they expanded it to the state. So that's where it originated from.
And so how is coordinated school health currently being implemented in Tennessee?
Well, it's different in every county, but every school district has someone like John C. and myself. They have a coordinator, and some have assistant coordinators. I think it really depends on how large the district is and how small, but it's not the same in every district. But it's implemented. For ours, we have a larger district, so we have pockets of the 8 modules, different departments that work within Metro and kind of work with us and help us. Whereas a smaller county, the specialist might do all of the whole gamut of things. So it's different in every county. So.
And what sort of success have you seen so far with the work that you've done for coordinated school health?
Do you want to do this one or do you want me to?
In our district specifically?
Sure.
It's coordinated school health in our district has gotten a lot of programs into schools that they otherwise wouldn't not have had access to. I think we've had a 2% decrease in childhood obesity across Metro since coordinated school health became a part of Metro in 2007. Maybe a little bit more, but I think it's about 2%. But a lot of what we do in this district is reach out to community partners and things like that to help the schools with fill in the gaps to make their school a healthier environment. So we help them link up with those resources. So I think that that's something that is like a big benefit that coordinated school health has brought to this district in particular.
And I think just to push for education, like health education has become more important, and the focus on the whole child, where that's what John C. and I try to do is along with some other people, try to get that focus on them.
So what sort of activities specifically do y'all work with in terms of trying to get these coordinated school health programs implemented in schools?
Well, it's comprised of 8 different modules. So, for example, this year we're working with healthteacher.com to implement health education in middle schools. And then we're working with Vanderbilt or Peabody for Fizzy's Lunch Lab to get some nutrition education into certain elementary school if they want to do some evaluation and stuff on. We also work with the American Heart Association for Jump Rope for Heart. We work with Vanderbilt's GROW program. There's just different things. It could be anywhere from a wellness fair that they're doing to implementing a garden to family and community events. We just kind of, whatever they ask us for, we try to do our best to get that resource or provide them with those resources.
And what sort of barriers have you experienced in trying to implement coordinated school health programming?
I think that a big barrier that we have with coordinated school health is that we know that health is important to the academic success of children in schools. It's convincing everyone else that may have different focuses, especially with meeting test score requirements and things like that. So I think that's probably the biggest barrier that we face at the district level, and also that like healthy school teams face at the school level as well.
I think another barrier is probably our transition of the teachers, or the turnaround that we have with the turnaround, whatever you want to say, with the teachers moving from school to school, or as well as the principals, because we have to go in year after year with 140 schools and reintroduce it to the new principal, or reestablish a healthy school team. So those are some barriers that we have too that need to be fixed somehow.
So what sort of resources would you suggest that teachers seek out in terms of helping you all to implement this coordinated school health programming in their school?
When you mean resources, do you mean like what? Because we provide them with some resources,
Right.
But
I feel like maybe a lot of teachers aren't necessarily aware of all of the potential that you all can provide for them in terms of assistance in implementing programming.
well, we try to get into the schools as much as we can, which is another barrier that we have actually. But we make contact every year with the principals and try to meet the new principals and the new healthy school teams and assist them with their healthy school team first meeting that they have. But we also have like a lending library that we send out, and we email a manual to our administrators and to our healthy school team chairs with a bunch of resources on it. And we are constantly sending out emails to them. I say constantly, but not constantly. If we have a grant come up that we know about, or we have some kind of activity that we're doing to promote like Child Health Week, we'll send out information to them and just let them know that we're available. And Johnsy and I have talked about doing a healthy school team professional development next year, where we get the chairs to come in and speak with them and really get them to be knowledgeable about what's going on, and they can relay it to their teams and kind of go over what's important and how to establish a goal and things like that. And just attending a principals meeting and talking to the principals about coordinated school health, so that kind of thing.
So what are the goals that you all are currently focusing on in terms of your programming for coordinated school health?
Well, our main goal in coordinated school health is to focus on the whole child and to link academic success to the health of the child. So I think that that's our biggest umbrella of a goal. As far as specific goals right now,
The healthteacher.com.
well, yeah, employing programs like healthteacher.com in schools, and getting more health education like for middle schools, which is where healthteacher.com is. Getting that to be a part of middle schools, because it's not required right now. So we think if we could get that into middle schools, it would be a big step forward.
I'm trying to reduce the obesity rate. I think that's what a lot of times we focus on the physical activity and physical education and health education side of it, where the other departments kind of do some of the, like we have a counseling and psychological services department who focuses just on our counselors, and nutrition services who do that. And so I think we mostly focus on probably the healthy eating, physical activity, and the health education side. So, and that all ties in. They all link together. So,
What funding is currently available to help schools implement coordinated school health programming?
well, each district is given so much money by the state, and so that whatever money they have is what we have for funding. It doesn't increase at all, So after, I can't. It's different in every state. But if we get grants, they might have increase money that way. But as far as we only have so much, and we have 140 schools, and we try to divvy it up, or we'll purchase equipment or something for them, or like for example, this year we're doing awards. We're going to offer mini grant type things. But as far as individual schools, it's on an individual basis, really. I don't know how smaller counties do it, because they have fewer schools, whereas we only have so much money to go around to 140. So it's we can't just give out money to them.
So how do you suggest schools maybe find other supplemental sources of funding?
I'd say partnerships. In Metro, I don't know about other counties, but they have pencil partners, and just establishing partnerships with the community and getting the community involved That's a great way to use their resources, or even if parents own a local hardware store or whatever, get them involved, the parents involved, and just the local community members, and that'd be helpful, as well as the grants and stuff. Do you have anything?
No, that's good. Thanks.
What sort of laws and policies maybe affect or dictate how you implement your coordinated school health programming?
Well, any law that deals with like children's health has some impact on us. There's a physical activity law that they have to have 90 minutes of physical activity or physical education every week. So we work with that too, with the reporting of that, to make sure that our schools are meeting that requirement and are not out of compliance with state law on that. That in particular is one of the only laws that we actually have to make sure is being followed. There's also like the new updated family life and sexuality law. We just had a professional development workshop on that on Friday, actually. So the laws that deal with children's health do influence what we do every day, even if not directly, maybe indirectly. So.
Do you feel that the laws and policies are sufficient, or do you think that maybe there are some that could use, I don't know, a little
tweaking?
Yeah.
Well, I mean, yeah, as a former health education, I always feel that way. As far as, we've talked a lot about health education, but I would love to see it required and mandated for middle school and even elementary school. I'd love to see another year or physical education or more time that the students are required to participate in physical activity. Stuff like that. I mean, because that's my background and I think it's important. I don't know. I mean, yeah, there's always something, even the nutrition. Some of that could be changed with what they're serving the kids, but we have our supporters and we don't directly have lobbyists, I guess, but the state does, and people that help us to do stuff like that, like the American Heart Association and things like that. So.
Who do you think should be kind of the pioneers of coordinated school health programs, like within the individual schools? Like what sort of stakeholders need to be involved in that process?
Each individual school has a healthy school team established, and the healthy school team ideally is made up of someone from each of the 8 components of coordinated school health. So it would be the physical education teacher, the cafeteria manager, the guidance counselor, a parent, a student. So I think that all those people need to be involved. You can't just have 2 or 3 people, 2 or 3 teachers get together. You need people from, well, you can. A lot of them do, actually, but ideally, to make it most effective, if they have people from all those areas, as well as if they can include, like Nicole said, local business people involved in the community, community members, more parents, PTO, things like that, all need to be involved with the decisions about healthy school environment at the school level.
What are your hopes for future coordinated school health programming?
What did Susan say? That it will become institutionalized?
Yes.
That it will be, that when we walk into a school in Metro or across the state, and you say, hey, what is coordinated school health, they'll be able to answer like that. It's a functioning, a sustainable initiative. That it's the whole district knows about it. Everybody knows about it, and they're working towards the whole child, that kind of thing. I don't know if you want to add anything.
No, I think that's perfect.
Yeah, just institutionalized.
Yeah.
What do you think schools need to do in order to sort of get to that idealized vision?
Oh gosh, I don't know. It's part of education on our part, getting the word out there. When we implement these programs, and we have to market ourselves as well. We have to get the information out to the teachers and really promote it. And John C. and I try to do that. We try to get into the schools. We try to help the teachers as much as possible. But I think it starts at the top too, with administration, and it would start with the director having buy-in from them, it kind of trickles down. So if you have central office who buys into it, and then the administrators do, and that's going to trickle down to the teachers, and then definitely to the students. But it starts at the top, and we need, in order for it to be a successful initiative, we have to have success at the top and buy-in, and it'll go from there.
So, do you sort of feel that there is maybe a disconnect between like health education and what is sort of taught at the schools, and maybe the opportunities that are actually provided to children in terms of the food that's offered at schools or the amount of physical activity and services?
I don't think there's a disconnect, really, as much as a priority. Like the children are given healthy options, and they have to fall within a certain caloric intake and things of that nature, and follow the percentage of fat and protein and carbs and all this stuff. However, but I think the emphasis right now within our district, and only speaking with our district, are the test scores, and teachers have so much on their plate and so much pressure and administrators as well, for their evaluations and to perform and have high test scores, that it kind of, the wellness of the child, instead of falling into that category, kind of a health lesson kind of falls to the side.
I think not necessarily a disconnect, but maybe like like priority, or you don't think about it. Like, for example, during TCAP, they always have healthy snacks. They always get time to go outside and run around and
Make sure you get a good night's rest.
Get a good night's rest, and they emphasize that during TCAP to get good test scores. So why not emphasize it all year to get good test scores all year? But sometimes people don't think about that. So I think maybe a little bit of disconnect when it comes to things like that. But
Yeah. And the fact that they know it's important, but they don't have time for it. We've got to get
Right.
this math lesson, and we've got to do this. And in reality, they should find some way to link the two together.
So, I guess, what would you say the biggest misconception about coordinated school health programming and the importance of health to academic achievement?
Some of the things I think we face going to teachers and administrators is the look on their faces like, oh, here's something else. When in reality, they're already doing these things, and it's just putting it together and letting us know about it, and carrying it over and improving, accomplishing one goal, and then growing from that the next year, or that kind of thing. I think that's tough, because they're like, something else. This is why do we have to do this kind of thing? Which it's only a win-win situation. The students are going to benefit, and the faculty's going to benefit, because one of our modules is faculty and staff wellness. Well, the teachers are role models, and so the kids are going to see that, and I think that's as far as I've seen.
no, that's exactly what I was going to say. It shouldn't be viewed as something separate. It should go right along with what they're doing already. That's exactly what I was going to. What I was going to say.
So, can you sort of explain maybe the difference between coordinated school health, as you were discussing the 8 different modules, and how it benefits teachers and a variety of stakeholders? So the differences between coordinated school health and just health education in general, which is sort of what schools kind of think of.
Sure. Health education is basically the teacher getting up there and teaching to the student kind of thing, whereas coordinated school health, and there are different topics within that, different strands. However, coordinated school health, and like we said before, focuses on the whole child. It's basically empowering the child to be responsible for their health education, or their health of their body, physically, mentally, socially, as well as spiritually. It's getting the parent involved. It's getting the community involved. It's not just talking about the health of the child, but it's also talking about ways to make a healthier environment for the community. What are the needs of the students? What are the demographics, for that? What are the needs of the community to make it a better school, just all around? For example, some of the modules, like we said, are nutrition, it's health care or student services, there's health education, physical activity, but there's also the promotion of faculty and staff, the healthy environment, and what is it? There's one more, the psychological counseling. It's not just going up there and saying, run, or eat a nutritional breakfast, that kind of thing. It's empowering the child and linking the academics to a successful life here, but also in the now, but also in the future.
Yeah, it's not just about learning about health, it's living it and giving them the tools to, when they get out of school, not just in school, but when they get out of school, that they know these things and they make it a part of their life. You can teach about nutrition labels, but do they really get it? You can tell them, well, you need cardio exercise to be healthy, but just telling them doesn't really make an impact. It's about living it. So.
And the health education is just a part of that, because in counseling and psychological services, it's about providing counseling for the parents if they need it. If a child has diabetes and needs counseling because they're not doing what they need to do nutrition-wise, or they're having some kind of setback from it, it's providing those type of sources or resources for that family. Just like with the vaccines and immunizations, getting the word out to the parents, but also dental health care, or vision screenings, all of that. And so health education is just a small part of it.
And you mentioned the importance of teachers in all of this as role models for the children while they're at school. Can you maybe briefly discuss sort of the role of the teachers as these role models for the children, and maybe provide some tips for teachers?
I think the biggest thing is just getting involved. The child's looking at you for everything. The teacher has become not only the teacher, but the caretaker, the disciplinary one, the friend, the nurturer. So these students look up to these teachers, or they're watching them at all times. So the smallest thing is not having a Coke in your hand, or watching what you eat, bringing in fast food. These kids are watching everything. So just get involved. Want to be a part of creating a culture of wellness for your faculty, your staff, and your community. Just. Did you have anything?
That's good. No.
Do you have anything? Just
No,
get on the
that's
healthy
good.
school team. In the smallest little thing, you might have great ideas, or you might have partnerships and know a way to get other people involved. Just getting involved.
Are there any other important concepts about coordinated school health that you would like to share with teachers or school administrators, parents?
I think the one important thing is you got to have buy-in. For the students to believe it, and the teachers to believe it, it starts with the administrators, and having their support and their buy-in is huge. If you don't have that, then it's hard to be successful. That's one tip, is make sure you get administration on board and make sure they believe in the health of the child and how it's all linked together. Any other tips for administration? Faculty, read the question again. You'll cut this stuff out, won't you?
Just any other important tips or concepts about coordinated school health that you wish to share?
And remember, it's a win-win. It's a win for everyone, because you're going to get the test scores you want. You're going to get the healthy child, less behavioral problems, a more motivated child, higher self-esteem. Like I said, it's a win-win. The teacher's going to be happier because it's less behavior issues, and so that'll make them happier, which will make administration happy. It's just, like a domino effect. It's a win-win for everybody.
And just taking the time to give the concepts of coordinated school health supports a chance, because there's study after study that show that a healthy child is more successful academically. It's just making the time to integrate that health into the school to see the results of that. So.
Do you have any suggestions of maybe ways to integrate health into the classroom without really disrupting, the flow of curriculum? And
Yeah, I think, and that's one reason why we kind of paired up with some of our community partners is because of that. I know one in particular, they focus on the Common Core, but yet they link up or they connect the health education with like math or with social studies or whatever. It can be done in any area, any academic discipline at all. It can be easily done. It's just taking the time to actually become a little more creative and do that. But it can definitely be done, and it is done. A lot of teachers do it. I mean, it's something as small as washing your hands, or can be integrated into any kind of lesson, or an English lesson, talking about write a paper or write something about a healthy fruit and vegetables or something like that. It can be done in any class. It's just taking a little effort, a little time, and a little effort to do that.
And even like we had a healthy classroom challenge contest, and teachers were asked to show how they integrate health into their everyday. It wasn't just physical education teachers; just all kinds of classroom teachers. And it can be anything. Just math class, you can do subtraction and then do jumping jacks for your answer. Anything. There's just so many ideas. It's just like she said, just branching out and integrating those into your lesson, and it can make it more fun for the kids as well. Something different.
Great. Well, thank you so much.
Thank you for joining us for this interview with Nicole Proffitt and John Z. Holt of Metro Nashville Public Schools Office of Coordinated School Health. This has been a presentation of the Vanderbilt Online Guide for Children's Health from the Vanderbilt Children's Health Improvement and Prevention Department of the Monroe Carroll Jr. Children's Hospital at Vanderbilt.